A 10-month-long closure on entertainment spots, including bars, was lifted in the updated COVID-19 regulations issued on January 29th. The government of Ghana, in the amended gazetted order, made way for the reopening of bars at a 40% capacity throughout the month of February. The order stipulates that indoor and outdoor dining at a bar shall only be permitted between the hours of 4 a.m. to 9:30 p.m., where tables are spaced 6 feet apart and no more than 4 persons are seated at one table and are 3 feet apart. The Ghana Tourism Authority was entrusted with ensuring compliance of the COVID-19 measures at the bars. The government's move was met with sharp disapproval from some sections of society who contended that there's a higher chance of the virus being transmitted at the bars since it was impossible for persons to wear masks while imbibing. Others raised concerns about the fact that the churches were given approval to reopen at a 25% capacity since August 2020, and that order has never been amended to allow for the gathering for more churchgoers. However, bars seems to have been given priority even though the risk of infection is higher. In adding her voice in condemnation of the move, Shadow Public Health Minister Dr. Cummings pointed out that the decision by the government is devoid of sound reasoning.
COVID, there's still an uptake of cases in COVID in Ghana for a small population, over, 17% case fatality. And so I think it's very foolhardy at this point to be opening up when some countries are locking down. Barbados, they are locking down and with heavy fines if you breach any of those protocols.
She further cemented her point by suggesting a 25% capacity cap across the board for bars, restaurants, and churches. She is questioning the motive behind the decision.
I don't know if it's a balance between profits and public health, but they can't compromise when it comes to health because people are dying, And so I think it's not wise, to open up 40% and compare the churches 25%, and why not walk straight across the board, 25% right across the board.
She further added that such decisions should be made based on evidence-based assessments that there is containment of the virus in the country. Dr. Cummings highlighted that the opposition continues to play little or no part in the management of the COVID-19 situation in Ghana. She alleged that the government has been making unilateral decisions. Meanwhile, President Irfan Ali on Saturday during a press conference justified the reopening of bars by indicating that the Ministry of Health has increased capacity to manage the COVID-19 cases.
We have increased our capacity to deal with COVID tremendously. Not only at the Lenendal facility, but in terms of level of awareness, type of treatment, and everything. That is why, although we have had increases so far, and we hope this trend the trend that I'm going to allude to continue, the transition to the ICU has been managed.
Guyana saw a total of 1,009 new COVID-19 infections in the first month of 2021. Temika Rodney reporting for the HGP Nightly News.